Hey, it's Dr. A. Want to answer a very, very common question. Most of the things we talk about seem to be common questions, but this one comes up as very frustrating for people, and that is why do I react to treatment in a direction I don't think I'm going to react? So, normally we expect if we have a disease, we have a treatment, and we get better. That should be a very linear thing. And what I tell people is if you've sprained your ankle, broken a bone, you got strep throat, something like that, probably that's how it's going to work out. Now, none of those are pleasant, but there's a clear problem. There's usually a pretty clear treatment, and then there's resolution over a certain amount of time. But one of the things that happens with people is if it's not an acute problem like that, in a complex or a chronic case that's going on, you may actually get the opposite that happens because in something like a broken bone, there's one large problem, there's one large solution, and it kind of lines up. In a complex case or a chronic case or something that's being complicated by other factors, you may have 10 of those things going on or 100 all at the same time. And so one of the things to consider is that these things would happen not so much in a very healthy person with a couple of exceptions, but in people that have underlying problems that might be totally well controlled. So let's say you have an autoimmune disease, or let's say that you have some other type of chronic condition, but it's pretty well controlled. You and your healthcare providers have got it lined out. That doesn't mean that your body doesn't have some weak places. Now, everybody does, but if you have an underlying disease and it's controlled, but it's still there, you may have some kind of holes in the bucket that you don't notice till you get something new thrown in on top. So when you have that going on, you want to be thoughtful about you may have a more complex trip to healing if you have an underlying chronic disease. The other thing is if you have an active chronic disease that's not totally well, maybe you have symptoms under control, but your body's still very inflamed. There's either maybe autoimmunity or chronic infectious problems, or certain toxicity syndromes that do this, etc. The other one, if you're listening now in 2021 or anytime near, you've probably heard of COVID. Well, there's the idea of long COVID or COVID long haul patients. Who I am speaking with many of them and hearing stories and doing a lot around long COVID. And that's sort of a unique one where you have people who are completely healthy, had no known underlying problems, and they get hit, like a cement truck, and they get COVID. And then in the post-COVID time, they keep all these symptoms that are just really, really perplexing and very difficult to deal with. So long COVID is a unique example of what normally would happen to somebody with a lot of underlying problems. Now, certainly, if you already had other problems and then you get COVID, you're still more likely to take a while to resolve, et cetera. But I have seen and talked to and interacted with enough people now who were seemingly quite healthy before they started with COVID that they have a lot to do. So then you start to treat them, and then all of a sudden things don't work out the way that you think they should. That's not just for long COVID. This could be any other chronic illness. And one of the concepts that I think is most important to keep in mind so that you keep your sanity while you're going through this longer process of healing is that your body physiologically, when you are sick, whether it's a lot of stuff all at once, a really big input like a bad case of COVID, a bunch of chronic issues, autoimmunity and infections mixed together, whatever it is, when it's a whole bunch of stuff, your body literally physiologically adjusts to what's called a new normal. And so your body believes that if your hormones are out of balance or your inflammatory chemistry is high and you're inflamed, your body starts to believe that's normal. Now, it didn't happen the first day, but with chronic illness, you get a lot of confusing signals. So the new normal is not a good normal, it's just a new normal. So then think about trying to take yourself from the new normal, which is sick, and your body does this as a matter of preservation. It's like, well, if these problems aren't going to go away, we're going to adjust the physiology around these problems because maybe they're just going to be here forever. It's going to be part of us, right? So your body now, and again, this doesn't happen overnight, this takes some time, but your body now believes any change from abnormal, this new normal that's not good, is not going to be good for you. Your body really gets that confused. So then when you and your healthcare team go to right the ship and balance everything back up, it feels to your body like there is something very wrong happening. Okay. Analogy would be if you're totally healthy and then suddenly you get a change, you get an infection with fever and aches and all of this stuff, you know that that's not your normal, right? Well, it's all flipped upside down when you have a chronic illness where your normal is that you don't feel well in any number of ways. And so trying to push you back towards normal feels odd to the body. So part of why you're reacting to treatment sometimes is that it's doing the right thing. It's just that your body neurologically, hormonally, musculoskeletally, sometimes all of the body systems resist moving away from illness in the beginning. Now, the body does like to go back to normal and like to a healing plane, but when it's been real sick, it's not a quick trip. So that's probably the biggest reason why that can happen. Now, another thing that can happen is a direct effect. This happens a lot with people who may be given a medication that kills, say, microorganisms, whether they're bacteria or fungus or whatever. And either just because of the sheer magnitude of the organism that's dying, so you had lots of it in there, or you had maybe a lot of relatives of that organism that your doctor thinks they're killing and they're killing a bunch of other ones. And so the therapy causes microbes to die, which creates a lot of inflammatory and immune activity, which is good, but it doesn't feel good. Okay. Now, we'll do a whole thing about die-off syndromes and all of that. In fact, I'm going to do a long podcast on all that. But that's the bottom line, is your body is trying to eradicate something. The immune system gets active. Whenever your immune system gets active, you can get unpleasant symptoms. And you think, well, I'm taking the anti-infective drug to kill that stuff. Shouldn't I feel better? Well, you will, and you should feel better, but not always right away. The other thing that I've seen happen is sometimes, we sometimes we doctors act, like we know more than we really do, but, we may be targeting one particular microorganism or a family, and the drug that we're using might kill 3 related families or 3 unrelated families. And we may not know from your signs and symptoms, if say you had a bacterial type of a walking pneumonia, how many organisms are in there. So we might think that we're going in to kill a small, family, and we kill a whole neighborhood. Well, that's good because the neighborhood was a bad neighborhood and it should be gone. But your body's going to react a lot more aggressively. Okay, so that's one of the reasons why that can happen, sort of a direct effect. The other is this sort of new normal effect where your body just doesn't want to, it doesn't like to ratchet back to normal. Same thing happens if your hormones have been imbalanced for a long time, or maybe you've had a low thyroid condition or whatever hormone. If it's been a long time, your body's used to that. Doesn't like it, but it's used to it. So you start to take hormone replacement or do some other therapy for it. It may feel very odd for a while till you get used to the new normal. Now, there's a lot of other things, but the real point I wanted to get to here, as I said, when it gets to like die-off syndromes and other, syndromes that go along with chronic illness treatment, I'm going to be doing a long-form podcast on that we'll put up here on YouTube as well. But mostly I wanted to get to what are some top tips for dealing with this. I'm not reacting well to my treatment, and I want to get better, but I don't feel like I'm getting better. The first thing is to, ask your healthcare provider, stay in contact with them. If you have a chronic illness or a lot of complex things going on, ask them, what kind of odd reactions can I have? Can I get like die off things from this, or do I need to take, things to help out with my digestion or whatever it is that they're working on treating? Talk to them. One of the things that happens when you're healthcare providers, you've said it so many times to other people, sometimes you assume that, well, everyone would know that they should drink more water or they should do whatever. Ask us. We like that. We like to be reminded. The other thing that you want to ask, and normally your healthcare provider will tell you this up front, but if there's signs or symptoms that would mean that this therapy is too strong, or too much for me, or I'm having a reaction, you want to know what those are when you're taking it, if you have never had the therapy before. And so they will generally say, or if it's a complex therapy, they may give you a handout that says, these are common symptoms, but if you get these symptoms, call us right away. For example, there are some therapies where your heart, can have certain, heart can start racing or something, and we need to call right away. Or if you start getting dizzy, or you start having other things. Whereas they might say, almost everybody who takes this has digestive issues, and you can do these things about it. Those are kind of normal, and we just deal with them as they go along. So really stay connected with your healthcare provider, and they will tell you which things are red flags that you need to call them about, or get in and be seen right away. The other thing is, to be patient with the process. And when you're sick, the last thing you want to do is be patient with anything. But if you've been sick for a while, or you get hit with something very unusual like long COVID, or you have an underlying disease and then you get another one on top of it, it's a journey. It's not a 1, 2, 3 step destination that you're in. So as hard as that is to do, you do have to take a deep breath. But the other thing is just be open and honest with your healthcare provider. We know it's frustrating. We know it's frustrating for us. We'd like you to heal faster. It's frustrating for you. And just keep checking in, because sometimes there are things that can be tuned up or changed around or whatever. And that is a two-way street. I always tell, especially chronically ill patients, but everybody, your body has a language it speaks. And the language is a nonverbal language. It's usually signs, symptoms, and the way that you're reacting to treatment. Those things all mean something to your healthcare provider. So, but they don't know what's going on inside of you. So stay connected. And if things really are going off the rails, reconnect and just see what's going on. All right. Well, that's all our time for today. We'll be back with more later. Please like, share, subscribe, notifications, all those things that I barely know what they do. Please do those if you want to, and I'll see you later on the channel.